There are basically two types of lower eyelid blepharoplasty. One is fat removal technique, the other one is fat preservation. Fat removal techniques can have issues themselves with removing too much fat and causing hollowing. Fat repositioning or transposition is the most advanced technique. It takes the existing fat around the eyelid, moves it down where there's indentation, and acts as a permanent filler for the patient's lifetime. Yeah, you can expect about 10 to 14 days of bruising and swelling. Stitches come out roughly by day 4 or 5. We take extra steps in order to move the swelling and faster along by injecting steroids into the eyelids at your suture removal. Most of our photos are taken somewhere between 2 and 3 months post-operatively. Lower eyelid blepharoplasty doesn't remove dark circles, it can improve them. The fat pads that live around our eyes have a blood flow to them that's seen as a purplish coloration. And with fat removal or fat preservation techniques, it can improve the dark circles, sometimes eliminate them, but there's no guarantee that they'll be completely gone. The results of lower eyelid blepharoplasty are considered permanent. With fat transposition techniques, the fat is permanently moved and acts as a filler over the patient's lifetime and should not have to be redone over that patient's lifetime. The primary purpose to have a lower eyelid blepharoplasty is to eliminate eye bags, smooth out the natural transition from the lower eyelid to the cheek. That is best done with fat transposition and preservation techniques. So instead of removing the fat, you're moving it around and using it as a permanent filler to achieve the smoothest contour from the lower eyelid to the cheek.